All right, let's talk about something that's pretty high on most people's worst nightmare list, a dental emergency. It's scary, it's painful, but here's the good news. Having a plan can change everything, and that's exactly what we're building today. So imagine this. You're eating, and suddenly, crack. Or you wake up in the middle of the night with a throbbing pain in your jaw that just won't quit. We've all had that jolt of panic, right? But what if, in that moment, you knew exactly what to do next? What if you had a clear, step-by-step plan? Well, that's what this is all about, turning that panic into calm, cool action. Okay, so to build our plan, we first need to understand what we're actually dealing with. Let's figure out how to spot a true dental crisis when you see one. So what is a dental emergency? It's any situation that needs immediate help to either save a tooth, stop a lot of bleeding, or deal with really bad pain. We're not talking about a little sensitivity that can wait. We're talking about the big stuff, where time is absolutely of the essence. And here are the telltale signs you need to look out for. A really bad toothache, the kind that pain pills don't even touch? That's one. Oh, and this is a big one. Swollen cheeks or gums. That's a huge red flag for an infection that needs to be dealt with like yesterday. And this quote just hits the nail on the head. Acting fast isn't just about making the pain stop right now. It's about stopping a small problem from turning into a much bigger, way more complicated, and way more expensive one later on.
Okay, so you've recognized it's an emergency. What you do in those first few minutes can make a massive difference. Let's get into your immediate first aid plan.
Your response boils down to 3 simple, crucial steps: rinse, compress, and save. First, a gentle rinse with some warm salt water helps clean things out. Second, a cold compress on the outside of your cheek will be your best friend for managing swelling and pain. And third, and this one's a biggie, if a tooth gets knocked out, your #1 job is to save it.
Let's really drill down on this because this is so important. If a tooth comes out, you've got to handle it by the crown. That's the top chewing part. Never ever touch the root. Give it a quick, gentle rinse, no scrubbing. Now, the absolute best thing to do is try to pop it right back into its socket. If you just can't, put it in a little container of milk or even your own spit. That'll keep it alive on your way to the dentist.
Okay, you've done your dental first aid at home. Now it's time to tag in the professionals. Where do you even go, and what should you be looking for?
This is where emergency dental clinics are a total game changer. Their entire reason for existing is to give you fast, urgent care. They're set up to minimize the damage and, most importantly, to get you out of pain as quickly as humanly possible.
So what can they actually do for you? They're not just about patching you up and sending you on your way. They can do quick assessments to figure out what's really going on, give you immediate pain relief, and if a tooth is just damaged beyond repair, they can handle an emergency extraction then and there. The whole point is to offer real solutions right away. So, the big question, do you just show up or should you call first? Well, most emergency places will take walk-ins, but here's a little pro tip. Calling ahead is always the better move. It lets the staff know what's coming so they can get ready for you. It's a tiny step that can seriously cut down your wait time and make the whole thing a lot less stressful.
And that brings us to what is maybe the single most important part of your plan. Now, this number here is just an example. The real takeaway is for you to take a minute right after this to find a good emergency dentist in your area. Find that number and save it in your phone right now. Trust me, future you will be very, very grateful.
Okay, you've done the first aid, you've made the call, you're headed to the clinic. So what actually happens when you walk through that door? Let's pull back the curtain on the visit itself. The whole visit is designed for efficiency and to get you comfortable. First, they'll do a quick assessment to see what's up. Then, priority #1 is pain relief. After that, they'll tackle the immediate problem, stopping the bleeding, dealing with an infection, before finally sitting down with you to map out a longer-term plan to get everything back to 100%. And that's really what these clinics are all about. It's not just about the technical stuff, it's about providing care and making you feel safe when you're feeling pretty awful. It's about knowing you're in good hands at the exact moment you need it most. So, when you put it all together, the main idea is pretty simple. Being prepared is your best defense. It's your superpower. Knowing what to look for, knowing some basic first aid, and having that number ready to go, it turns a full-blown crisis into just a problem that needs solving. And that brings us to the final question, and it's really for you. You can't put a dental emergency on your calendar. It just happens. So the question is, what are you going to do when it does? Your plan doesn't need to be fancy, but you do need to have one. So, do you?